I'm preparing YouTube stream.
All right, you let me know when we're live.
Okay. We are live.
All right, good evening and welcome everyone. I call the October 15th regular meeting of the Franklin City School Board to order. And I welcome everyone and thank you for your patience with us tonight, as I know we ran a little bit over in our closed session. That being said, that leads us right into 2.3, which is a motion to come out of closed session. Do we have a motion?
I move that the school board, having been in closed session pursuant to a proper motion, come out of closed session.
We have a motion. Do we have a second?
Second.
I second.
We have a motion and a second. Any discussion? All those in moving by ward, all those in favor signify by saying aye, and of course nays and abstentions have the same opportunity.
Bob Holt, Ward 1, aye.
Marshall Williams, Ward 4, aye.
Andrea Shelton, Ward 5, aye.
Jerry McCreary, Ward 6, aye.
Carrie Johnson, at large, aye.
Amy Phillips, Ward 2, aye. And Ms. Smith, are you with us by chance this evening? I don't see her present, so that is 6 of us, and that motion carries. Next up, we have certification of our closed session. Do we have a certification?
Whereas the Franklin City School Board has convened a closed meeting on this date pursuant to the affirmative recorded vote in accordance with the provisions of the Virginia Freedom of Information Act. And whereas Section 2.23712.d of the Code of Virginia requires a certification by the school board that such closed meeting was conducted in conformity with Virginia law. Now therefore be it resolved that the Franklin City School Board hereby certifies that to the best of each member's knowledge, 1, only public business matters lawfully exempted by Virginia law were discussed in the closed meeting to which this certification applies, and 2, only such public business matters as were identified in the motion convening the closed meeting were heard, discussed, or considered.
We have a motion. Do we have a second?
Second.
We have a motion and a second. Any discussion? Again, moving by ward, all those in favor signify by saying aye, and nays and abstentions, of course, have the same opportunity.
Bob Holt, Ward 1, aye.
Marshall Williams, Ward 4, aye.
Andrea Shelton, Ward 5, aye.
Jerry McCreary, Ward 6, aye.
Carrie Johnson, at large, aye.
Amy Phillips, Ward 2, aye. That motion carries. Next up are motions from closed session. We have, I believe, a few motions from closed. We do have a personnel agenda. As we discussed, item 3 will be pulled and voted on separately. So we would have a motion in regards to the personnel agenda, with the exception of item 3. We will have and then we should have a motion in regards to item 3 of the personnel agenda. And then the final item from closed would be the vote to accept the agreed upon terms to the amendment to the superintendent's contract, as we will have to have a discussion with her on those agreed upon terms. And then we will have to come back and vote on, if an agreement is reached with her, we'll have to vote on that. Does that make sense? That's a lot. All right, so let's take them one at a time. So first will be personnel agenda with the exception of item number 3. Do we have a motion in regards to that?
I move to approve the personnel agenda excluding item 3.
We have a motion. Do we have a second?
Second.
Second.
We have a motion and a second. Any discussion? All those in favor, moving by award, signify by saying aye. And of course, nays and abstentions have the same opportunity.
Bob Holt, Ward 1, aye.
Marshall Williams, Ward 4, aye.
Andrea Shelton, Ward 5, abstain.
Jerry McCreary, Ward 6, aye.
Carrie Johnson at large, aye.
Amy Phillips, Ward 2, aye. With 5 votes, that motion carries. Next up is the personnel agenda, item number 3. Do we have a motion in regards to that? Do we have a motion?
Accept item 3 as written.
We have a motion in regards to item number 3. Do we have a second?
Second.
We have a motion and a second. Any discussion? Again, moving by ward, all those in favor signify by saying aye, and of course, nays have the same opportunity.
Bob Holt, Ward 1, aye.
Marshall Williams, Ward 4, aye.
Andrea Shelton, Ward 5, aye.
Jerry McCreary, Ward 6, aye.
Carrie Johnson at large, abstain.
And Amy Phillips, Ward 2, aye. With 5 votes, that motion carries. Next up would be a motion to accept the proposed terms of the amendment to the superintendent's contract as agreed upon. Do we have a motion in regards to that?
I motion as so stated.
We have a motion. Do we have a second?
A second.
We have a motion and a second. Any discussion? Moving by ward, all those in favor signify by saying aye. And of course, nays and abstentions have the same opportunity.
Bob Holt, Ward 1, aye.
Marshall Williams, Ward 4, aye.
Andrea Shelton, Ward 5, aye.
Jerry McCreary, Ward 6, nay.
Carrie Johnson at large, abstain.
And Amy Phillips, Ward 2, aye. That motion with 4 votes does carry. Any other motions from closed? All right, next up will be the Pledge of Allegiance. Ms. Moore, I'm sure you have done your duty as always and given us a flag to salute. So if everyone would join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands,
And
one nation,
nation,
under God, indivisible,
indivisible,
with liberty and justice for all. All right. Up next is item 2.7, approval of the agenda. Do we have a motion to approve the agenda?
I motion to approve the agenda as presented.
We have a motion. Do we have a second?
second.
We have a motion and a second. Any discussion? Moving by ward, all those in favor signify by saying aye. And of course, nays and abstentions have the same opportunity.
Ward 1, Bob Holt, aye.
Marshall Williams, Ward 4, aye.
Andrea Shelton, Ward 5, aye.
Jerry McCreary, Ward 6, aye.
Carrie Johnson at large, aye.
And Amy Phillips, Ward 2, aye. That motion does carry. Next up is roll call. Ms. Moore, if you would lead us in roll call, please.
Sure. Robert Holt,
Present.
Amy Phillips,
Present.
Tanya Smith, Marshall Williams,
Present.
and Andrea Shelton,
Present.
Jerry McCreary,
Present.
Carrie Johnson.
Present.
All right. Next up is 2.9 citizens time. Ms. Moore, do we have anyone that signed up or sent anything in for citizens time?
No, we have not.
Okay. Next up is item number 3, which is our consent agenda, which is very, very small this week. We have 3 items. We have a budget adjustment. This is in regards to some funding that has come in, so we have to allocate that within the budget. And also do a budget adjustment to be sent to the city so that they can adjust that budget as well. So that is this. That is what this represents. So those items were in regards to GED and adult ed, and some CARES Act funding as well. And the next item up is asset disposal. Of course, you know, we do have that ongoing vehicle replacement plan that we put in place a few years back. And we did just replace out some of those vehicles. And as part of that, there are 4 vehicles that we are looking to dispose of. Those 4 items are listed there for disposal. And then the last item is the Camp Community College MOU, and this is for the Career Coach program with VCCS. And we just did the Camp College memorandum MOU at our last meeting in regards to the new teacher academy. So pretty standardized, just like that. This is just in regards to the career coach program.
Is
Sorry,
the
I
June
had a moment there.
30 date correct, or is it June 30? I'm not sure.
What was that, Mr. Holt?
The ending date is July 30. Is that correct, or should that be June 30?
The community college puts in the date, so that's July 30th, because they work with the graduates after they graduate as well. But I can check on that too.
Okay. It makes sense. Thank you, Dr. Sterling.
Yes, sir.
All right. Any other questions in regards to the consent agenda? Hearing none, do we have a motion in regards to the consent agenda?
I move to approve the consent agenda as presented.
We have a motion. Do we have a second?
Second.
We have a motion and a second. Any discussion? All right, moving by ward, all those in favor signify by saying aye. And of course, nays and abstentions have the same opportunity.
Ward 1, Bob Holt, aye.
Rochelle Williams, Ward 4, aye.
Andrea Shelton, Ward 5, aye.
Terry McCreary, Ward 6, aye.
Carrie Johnson, at large, aye.
Amy Phillips, Ward 2, aye. That motion carries. Next up is the superintendent's report. So Dr. Sterling, if you would proceed.
Yes, thank you so much, and good evening to everyone watching us this evening. Today, I would like to start out with the the school board student liaison report. Board members, because the report was so lengthy for the month of September and October, it will be attached to board communications as well as uploaded to our website. But at this time, we would like to have Dr. Andrea Shelton present our board liaison for the month of September and October.
Ms. Moore, will you scroll down? Samuel Lyons, the Franklin City School Board Student Liaison for the month of September and October 2020 is Samuel Lyons. Sam is a senior at Franklin High School and is currently ranked 4th in his class. He takes dual enrollment classes at Camp Community College, all while maintaining a 4.03 GPA. Sam is a member of the National Honor Society and served as the Vice President for Future Business Leaders of America. He has played basketball for 3 years for the Broncos and is looking forward to the season ahead. After graduation, Sam plans to attend a 4-year university and major in computer science.
That's wonderful. We are very excited and proud for Sam. Sam's bio, that information will also be uploaded to our website. We want to make certain that we highlight our board liaisons every month, so they'll be up for the entire year. Next, we're going to have Mr. Jeff Ryder do the financial report. Mr. Ryder. Okay.
There we are.
There he is.
Good
There
evening.
he is.
Thank you. Good evening, board and Dr. Sterling. We are in the season now to begin the budget for incredibly, the 2021-2022 year already. This is the tentative budget calendar. It's based roughly on the same thing as last year. So if we scroll to the next page, it's tentative because you all have to kind of review it and approve it. So the budget kickoff meeting I had placed on for October 21st, the pre-budget kickoff meeting. So we kind of get our act together, what we're doing, and then the budget kickoff meeting is on Friday that same week. Then throughout November, we have the details of what we're putting together and assembling. December 3rd, I had penciled December 3rd in as a joint budget work session with the city. So we have to, the reason that's in red is A, it's a joint budget work session with the city, and we have to ask them if that date's okay. So we got our board meeting in the in-between things, January, February. We really ratchet down the final numbers. We have our final joint budget work session with the city on March 4th. And by April, I believe the April 1st closed session, we will finally adopt, the 21-22 school board budget is due to the manager on March 8th, the city manager, and then we adopt on May 20th. It's roughly the same schedule as last year. And that's it for that presentation. Does anyone have any questions?
Any questions for Mr. Ryder? All right, thank you very much, Mr. Ryder.
Thank you.
Thank you.
Excellent presentation. Next, we'll have Dr. Holloran. She will do the federal programs update. And we have some exciting news.
Yes, we do. Thank you, Dr. Sterling and school board members. We are in receipt of additional funding. This time, this portion of the CARES Act funding is called the Coronavirus Relief Funds. And primarily the purpose of the funding is to provide support and relief to school divisions to assist as we transition and adjust to the parameters of COVID-19. And it definitely assists with the opening of the school year. The funding amount is $177,958. And the award period can go back as far as March 1st, 2020, all the way through December 30th, 2020. And again, the funding is for short-term usage and cannot be extended beyond December 30th, 2020 of an encumberment date. We're requesting approval to allocate the funding as follows. For facility upgrades, $150,000. For personnel reimbursements, $23,758. And for technology insurance to support our devices, which would cost approximately $4,200. And again, the funding is allocated directly to the school division. No grant award application is needed, and funding can be reimbursed again as far back as March 1st, 2020. Are there any questions?
Any questions for Dr. Holloran?
Yes, this is Jerry, Ward 6. There was, I believe it was 2 weeks ago in the public meeting, there was a presentation and some photos of the facilities. Is this in regards to those upgrades? I guess with the, for example, the temperature sensors? Does that include this type of thing?
No, this is, go ahead, Dr. Holloran.
And obviously that's a different funding source. This is another portion of the CARES Act funding that's awarded to states through the federal government.
So
and as funding is allocated through the states and through the government.
Well, let me rephrase my question. What kind of upgrades does this cover? Are these upgrades that have already been made?
No, these are facility upgrades that the division will be seeking approval to support. And I'll let Dr. Sterling or Mr. Ryder address that, please.
Yes, we can. These are facility upgrades, and we're trying to get the information at this time. We're working with a vendor because we wanted to have a touchless bathroom system for our children when they come back in. And this would help support you doing touchless urinals. automatic urinals, and touchless sinks. So again, we've been working on this project for quite some time, and we're getting all the numbers together so we can bring it to the board in the work session as well. So this will be absolutely new funding allocated to touchless bathrooms.
I see. Thank you for the clarification.
Yes, sir.
Dr. Sterling, I have one other question in regards to that.
Sure.
With that, the upgrades that we're looking at with the touchless system in the restrooms, will that require us to put out an RFP?
Yes, it will. And we are actually working with a company. We have our RFP. We've been looking at that with Mr. Ryder, and that's coming together very well. He broke a lot of the information down that you will get in the work session, so we can have an extensive conversation about that.
Awesome. Any other questions?
What are some of the personnel reimbursements?
Part of the,
Go ahead.
I was gonna say, part of the funding that was allocated allowed for us to reimburse for any personnel support that's needed to assist with the implications of COVID-19. For example, additional support has been needed in the area of human resources to ensure that we have staffing to assist with the virtual learning that's occurring and other human resource implications that may occur. So reimbursements between March 1st and December 30th can occur with the newly awarded funding.
So we were
Okay.
actually able to go back and reimburse ourselves from our HR specialists. So that was a good thing.
Okay, thank you.
Thank you, Dr. Holloran.
Any other questions? All right. So this is new funding. Do we need to have a motion in regards to approving this?
No, not at this time, because this is a grant that we were just awarded. We will ask for specific funding amounts to be approved in the work session, because you will get all the details of where it will be allocated, line item by line item.
All right, that works for me. If there's no other questions for Dr. Holloran or Dr. Sterling, you are good to proceed. And thank you, Dr. Holloran.
Thank you.
Excellent. Okay. Thank you, board members. Now we're at the portion of our board meeting that we discussed some time ago in August 2020, when we were looking at how we were going to reopen school. I want to thank the board members for voting to have a 100% virtual start for our students. It has been going extremely well, especially for our employees that appreciated going 100% virtual as well. During that meeting, I recommended that we come back to look at the state of COVID-19 in our community and in surrounding areas before we made a decision on if and when to bring our students back for November 5th or extend that longer. So I want to present to you our returning back to school information. Just to give you some background, starting early this year, we enrolled 1,056 students. Our soft enrollment data, we use the word soft enrollment only because these students were already enrolled, but we went and made phone calls to every single household to determine if the parents would like their students to come back virtually or in an in-person model. So you have the numbers before you. Household survey, 775 households. Of those household virtual learning, you had 67.2% that said they would like to have their children learn virtually. In-person hybrid model, which was 2 days in school and 3 days out of school, 32.8%. And we also surveyed our family if transportation was going to be a problem. So if they did agree to return to school, would they transport their child? Or if they were in an online model, would they transport their child for any reasons such as SGAs, like we're doing now with the testing? So school transport, 47.2% of our community surveyed said that yes, They will have no problem transporting their child. Excuse me, they would need school transport, and then cell transport would be 40.4%, which is kind of breaking even. We can go up. As you all know, we are still in phase 3. The governor has not lifted phase 3 to go to phase 3 and beyond. We are still at phase 3. And during phase 3, FCPS parents again had the opportunity to select online or in-person learning. However, on August 6th, again, with the superintendent's recommendation, FCPS school board voted for 100% virtual learning during the first 9 weeks of school. I'll make certain that that is corrected. So here we are reviewing the state of COVID-19 in Franklin and our surrounding areas. We have the pleasure this evening, board members, to hear from Dr. Todd Wagner, who is the director of the Western Tidewater Health District for the Virginia Department of Health. He was with us during a webinar and he gave a wealth of information during that time. There were a number of questions that our community had in the chat box, and he was so patient. He patiently answered every single one. And it was without further ado that we present to you this evening, Dr. Wagner, to go over statistics on what you all will be utilizing to determine our reopening. Dr. Wagner, can you hear me?
Yeah, I can, Dr. Sterling.
All
Can
right.
everybody hear me okay?
Yes.
Okay. Well, great. I'm going to go ahead. Well, before I share my screen, just real quick, I think most are aware, but just to kind of set the stage a little bit, I am Dr. Wagner, the director of the Western Tidewater Health District. And for those that may not be aware, Western Tidewater Health District encompasses the cities of Franklin and Suffolk, as well as the counties of Isle of Wight and Southampton counties. So that's our area of cognizance. We reside in what we call in the Virginia Department of Health parlance, the Eastern region, which includes Western Tidewater Health District, Chesapeake, Norfolk, Peninsula, and the Three Rivers and Eastern Shore Health Districts. So I say that, and we're one of 35 health districts in the state. And I share that information not to do a geography lesson here, but rather to inform you as I show you some of these dashboards tonight. I want you to just kind of have that frame of reference, because some of the information is at the state level, some is at the region level, some is at the health district level, and some is at the local level down to the city of Franklin. And so I wanted to make sure that was clear. So I'm going to go ahead and share my screen. Everybody see that? I hope. Is it good? Okay. So the first, I'm going to show you a set of 3 dashboards here tonight. The first one is our overarching VDH dashboard that we utilize. And I should say before I start also that the first and third dashboards that I show you are publicly available. And I suspect maybe some of you have seen information on one or one of these sites before, but the first and third are publicly available. The middle one is password protected, but it is being looked at for potential public release. So bottom line is a lot of what I'm sharing tonight is going to be publicly available to you and frankly, all of your families too. And so I wanted to make sure that was clear. Second thing I'd like to say about this data real quick before I start is this is all current data. It's as of today. But I will say this is not intended to be predictive data. It is where we're at now. In fact, it's a little bit retrospective, meaning, it comes about as a result of cases that occur in the last 10 days, 2 weeks, week, and lead up to today. And none of the data I'm going to present tonight really is intended to be predictive software. However, it does give us a good sense of where we're at, sort of some trends, and taking a look at like I say, where things are at and where they may be going. I recognize that all of you are here to make some challenging decisions on sort of start dates and opening schools further. So I'm going to try and give you the best snapshot I can as we are at this point in time. So what you're seeing here is again, the VDH overarching dashboard talks about cases in the state of Virginia, over 162,000. Also shows unfortunately, the hospitalizations and deaths were close to 12,000 hospitalization and nearing 3,400 deaths in the state of Virginia. I also also tracks outbreaks. I won't talk too much about those tonight. Talks about testing. We've done about 2.3 million tests in the state of Virginia, and we currently are hovering at about a 4.7% positivity rate. I think most of you are aware that positivity rate is exactly that. It's the number of positive test samples that we have, PCR samples for COVID over the number of samples that have been obtained. So right now the state is hovering at about 4.8%. As I drill down a little bit into locality, and again, I'll go first down to the Western Tide. Well, I'll tell you what, I'll go all the way down to the city of Franklin right now. But before I do that, I just kind of want to show you, I want to orient you a little bit here. Get out of that. This is the state of Virginia, kind of shows you how cases have trended over time. You can see the initial increase in cases, a dip in that June, July timeframe, and then an increase in the months of July, August. And as we got into early August, things began to taper down a little bit and have continued to taper. However, we're a little bit concerned starting here in the last couple of weeks. We're starting to see another little bit of a turn to the north. I don't know exactly what that means yet, but you can see we're obviously very in tune with trends. As we look at information, we don't look at it at any point in time, but this little upsurge here at the end is a little concerning. I'm hopeful that'll flatten out and maybe begin to drift down a little bit, but it does present itself as a little bit of an increase in this last couple of weeks since about October 4th, it looks like. So as I drill down to the city of Franklin, and you can see all of the cities and counties are represented here. Hopefully my internet will. So this is the city of Franklin, and again, you can see the scale is quite different. These are cases reported on a daily basis. You can see a relative sawtooth pattern here. Some of these large upticks that you see in cases, frankly, have been attributed to outbreaks in long-term care facilities. But typically, you're seeing the Franklin area. Early on, we were 1, 0, 1, 2, 3 cases a day. That increased to 3, 4, 5 cases a day. Then it was going upwards of 14, 12, in the teens. And then it's sort of tapered off of late back to more of the 3 to 4 cases per day. And we've stayed fairly steady there over the last 2 to 3 weeks. That's just a raw number of cases. If you look up here, these are some 7-day averages. Again, this yellow line is a trend line, so it kind of smooths out some of those sawtooths that you see. The 7-day average currently in the city of Franklin is 37.4 cases per 100,000. We are obviously to compare apples to apples, we need to be able to correlate that to a population per 100,000. Obviously, a large populous area would be expected to have a lot more cases. But if you look at the number of cases per 100,000, it sort of gives that equalizes that data. This data here is the number of total cases, 524 per 100,000 in the last 14 days, and I'll show you where that matters in a little bit when I get to the third dashboard. But you can see this raw number of cases for the city of Franklin. Staying steady. I would love to see it, dip down further down to sort of where it was back in the April-May timeframe. But we're still hovering. Although the good news is as of today, we're not seeing that appreciable upswing we sort of did here, but we're keeping a close eye on it. Next, I'd like to touch a little bit on percent positivity, as I talked about a minute ago. Again, a good hallmark, and we're typically looking nationwide to try and stay below a 10% positivity rate. Right now, this is the state of Virginia, again, hovering at about 4.7%. As you can see, it was much higher early on in the pandemic, dropped down, and then this was sort of the upsurge you saw again in that August timeframe. And then since the beginning of August, early September, we've seen a downward trend, and it's been staying at right around 4.7%. And if I drill down to the Western Tidewater region, unfortunately, I can't go down all the way to the city of Franklin, but I think it's important also to look at district data, because obviously your families, your students don't stay just within the city of Franklin. They're in Southampton, they're throughout the district. So I think it's important to have a perspective on the percent positivity within the district. And as you can see in Western Tidewater, we're hovering just a little bit above the state average, 5.2%. We were quite a bit above back in the early to mid September timeframe, upwards of 14-15%, and we've sort of stabilized again at about 5%, 5.2% currently. The next dashboard I want to take you to is this is the one that's password protected currently, but this drills down a little bit further into the city of Franklin. I'll go to Franklin here, and this talks about again, this shows you both burden, which is how much disease we have, and the trend in that burden of disease. So as you can see I don't think Franklin came up. Let me pull it up one more time here. As you can see right now, when we again look at that case incident rate, those numbers of cases per 100,000, we hold anything above 10 to be in that higher rate, high threshold rate. And right now, as I've stated before, the city of Franklin's sitting right at about 37.4 cases per 100,000. The trending on this is a little bit concerning, as I mentioned. The cases have been increasing for 9 days. It has not exceeded the 14-day threshold, so it's not considered an uptrend yet, but it's considered to be fluctuating. But this upward trend that we're seeing over the last week to 10 days is concerning to me. We're obviously not as high as we were earlier in the month of September, but a little bit concerned about the fact that this line's swinging northward. That percent positivity rate, as I said, this is a sort of a linear representation of that. Again, we'd like to see that below 10%. Right now, Franklin hovering at about 7.3. But again, you're also seeing a commensurate, a little bit of an upswing right here in that percent positivity rate. Last thing I'm going to show you in the last dashboard is this school metrics. And this was developed within the last 3 to 4 weeks. And it's modeled after the CDC metrics for K through 12. They measure risk in 5 categories: green, yellow, or green, dark green, light green, yellow, orange, and red. As you can see, low risk to high risk. And as we look at the city of Franklin, again, this is a little bit different lens. This is a lens of cases, new cases, a cumulative number of cases per 100,000 within the last 14 days. And you can see this number seems big. Just bump me out there. I apologize. This thing sometimes, I think it times out when it. So I apologize for that. I'll bring Franklin up again here. But as you can see, that number is relatively high, 524, again, per 100,000. So that isn't 524 cases. It's brought forward to 100,000 persons. And again, percent positivity a little bit better, what's deemed to be in the moderate risk category over 7.5 days. These 3 indicators, 1, 2, 3, those 2 I just mentioned, and the third is very important here too. This is one we can't really measure with a number. This is our ability to mitigate disease within the schools. And that's really reflective of the plan and the efforts that the school has in place or plans to have in place when students return. These are the measures, the 5 key mitigation strategies, which I'm sure you're all very familiar with, to include masking, social distancing, hand hygiene, cleaning and disinfection, contact tracing in collaboration with the local health department. So these 2 we can measure. The third one, although I think just as important, is really what can the school and the district do to mitigate the disease. There are also some secondary indicators, which the CDC says right up front shouldn't be used in themselves, but they're also to be used as sort of a supporting piece of information to support those core measures I described above. And in this case, we're doing a little bit better. There's not been a large change in numbers of new cases per 100,000 in the last 7 days as compared with the previous 7 days. So 7 days, a 7-day period, 2 7-day periods ago, and the last 7-day period. We've seen no change there. And this reflects the severity of disease, you might say, meaning how is the COVID disease impacting our hospitals? And you can see here that we're in the green in both of those measures, meaning we have good hospital capacity, and there are a very small percentage of beds being occupied by COVID patients. So that tells you, yes, we do have cases, but the severity of the disease is low, which is good, which is really, one of the most, one thing we want to watch very closely, because obviously, certainly we don't want people to get sick, but the real problem becomes when our hospital systems and our emergency rooms, et cetera, become overwhelmed. So that's kind of where we stand. Those are the 3 dashboards, and we look at a lot of data, every day. And again, folks, I would encourage you, we look at trend data. None of this in itself is intended to be a magical, number that you can completely hang your hat on. But in the sum total, as we look at the metrics I presented, and the mitigation strategies that the schools have in place, that's really it's the sum total of all of that that's important. And I know that sounds a little squishy, because it is. I mean, there's no magic, as I mentioned, no magic number that we can hang our hat on to say, well, if we equal this, that will equal, it being, it gives us a relative assessment of risk is what it does. None of this is a zero risk game. Obviously, as we bring students back, we will endeavor, and I know you will endeavor, to mitigate any disease that we can through the measures I described. I know we've got a very effective case contact investigation. Will be very much a part of that. And a lot of it will be contingent upon that, how we prepare, how we keep our mitigation strategies in place, and how we if we do have cases, I always bring forward the case, not if but when, because as we've seen with other districts that are already in place, there have been cases. But what I will share with you is, in a lot of the schools that are already having students in place, we have not seen large outbreaks of disease in the district. We certainly have seen cases, but we've seen those handled effectively. We've seen most of the cases brought in from the community and not large scale spread within the school. So I think that's a good sign. That means schools are taking it seriously, students are taking it seriously, families are taking it seriously, etc. I will say that certainly can change, and I would always reserve the right, and I'm sure Dr. Sterling and you are looking at, if things do worsen, there's room to close classrooms, there's room to close schools if necessary, but that certainly is not our intent. I know people, in many cases are wanting their students to get back to class, and I think there's an effective way to do that. But so I'll stop there. I'll stop sharing, and I will open it up to your questions.
Please. Thank you so much, Dr. Wagner. Board members, I'm going to turn it over to you. Do you have any questions?
Yes, just Jerry McCreary, Board 6. Do you have the numbers that you presented? Do you have them broken out by age groups?
You know, I have one graph, and I didn't have it tonight. The numbers of cases, I have it broken out newborn to 9 years old and 10 to 15 years old. Don't know if I'd be able to find that quickly, but I can make that available. What you do see is not an alarming trend. And in fact, cases in that age group have decreased over the last 5 to 6 weeks. So that's a very positive trend. The 10 through 19-year-old group is a little bit higher than the 0 to 9 age group. So, you know, that is, unfortunately, I don't have, and that would be just for the district that I would have. And I can pull that information and make that, in fact, as we're talking here, I'll try and pull it up if I can find it quickly here.
Thank you. Okay, anyone else?
Dr. Wagner, I noticed that your stats are based on 100,000 cases. The population of Franklin is only like 8,500. So I was wondering how that affects the actual statistics.
Yeah, what you do is regardless of the population, you're going to bring it up to 100,000. So in the case of Franklin, let's round it to 10,000. Every piece of data you see there would be multiplied by 10. So if it's 520 cases in this, or 52 cases, it's reflected as 520 for 100. It's brought to 100,000. Same in an area that is a million, it would be decreased by or divided by a factor of 10. That's kind of a commonly used reference point is per 100,000, because most cities, many are much bigger, many are quite smaller. So it's kind of somewhere in the middle there. So does that make sense?
Okay. Thank you.
I would just like to thank Dr. Wagner because he's been with us every step of the way for months and months. And I've also seen him in other meetings throughout the city and county and surrounding areas. So Dr. Wagner, thank you for making yourself so available to all of us.
Well, it's my honor and privilege, folks. I know it's been a long haul for all of us. It is not easy. It's very challenging. I know there's a lot of emotion in this. There's a lot of concern. There's a lot of questions. There's a lot of unknown, and that makes for a very difficult environment to make decisions. But we've tried to, and I know you've tried to make the best decisions and give the best recommendations we can based on the data at hand. So,
do you have similar data for seasonal flu?
We do to a certain extent. We look at hospitalizations. We look at numbers of cases. All of this methodology, all of this system, it's much more robust than our flu system. We may end up mirroring a lot of our respiratory disease surveillance systems, as we call these, after COVID, because there's been such a hunger for data and information that we've become much more deliberate and much more granular. But we do have much of the same data for flu. Flu is upon us. That is a concern. There's a thing called a twindemic. Many people are calling it. The seasonal flu, which is here. There are cases in Western Tidewater already. So in your travels and in your messaging, and I know we're doing it, I would ask you to please get the word out for flu vaccination for sure. So.
I have a question. I'm sorry.
Go ahead, Ms. Johnson.
This is Carrie Johnson at large. And I was wondering if you have any data on the number of asymptomatic people that were tested.
We do, but in many cases, sometimes we do not have the the luxury when we get data within the health department, we do mark or we do track whether it's symptomatic or asymptomatic, if it's positive or negative. So we can track some of that data. There is a far predominance throughout the nation, throughout the state, and here in Western Tidewater. As you know, many of the cases, most of the cases, the far predominance of the cases are asymptomatic. There's a lot of asymptomatic carriage of this disease. There's a lot of asymptomatic spread of this disease. Individuals that may not know they're infected, or because they're asymptomatic, spreading the disease. But I don't have any particular data I can show you, but I know there's a far predominance of asymptomatic carriage versus symptomatic in COVID infection. That's for sure, upwards of 80% nationwide. So it's a very high number. There's a lot of asymptomatic carriage, and that's another very challenging part of this disease.
Thank you. That helped me quite a bit, because I think that there's some concern in some areas that if you don't have it or you're not presenting with it, then you don't have it. And what you're saying is that the predominance is actually the opposite, the asymptomatic carriers who can then transmit it to those who have underlying issues, wherein it becomes more of a problem. Is that correct?
That is correct. Yes. And it's, and that is challenging. Obviously people, and the symptoms do vary, although many are likened to many respiratory diseases, cough, fever, shortness of breath, things like that. But there's a very large number of a lot of asymptomatic carriage. You're exactly right. So.
Any other questions or comments for Dr. Wagner? And Mr. McCreary, back to your question. I did find the data for Western Tidewater on cases by age group, and that's, of course, to date. And in Western Tidewater, I, of course, don't have it for Franklin, but in Western Tidewater, in the age group of 19 and below, it's 416 cases. In the age group of 0 to 9, it's 131. And in the age group of 10 to 19, it's 285. And that's coming from the VDH's website.
Right. Those are raw numbers again. Yeah. So those are, that's again per 100,000. If you're looking at the data, I'm assuming you are. So yeah.
Yeah, I'm looking at the demographics page.
Yeah, that's a demographic breakdown. It's usually about, on average, we've had about 9 cases per week in the in the 10 to 19 category, and right around 5 cases per week in the 0 to 9 category. And that's a very rough estimate. I'm trying to still find that graph I have that depicts that. If I can pull it up, I'll make it available.
Wonderful. Any other questions or comments for Dr. Wagner? Again, Dr. Wagner, I will reiterate what Mr. Holt said. Thank you very much for working with us through every step of this process. I'm sure this has been, from the health department standpoint, very challenging as well. And I know that from looking at the VDH site, it's been a work in progress, and it's still a work in progress because we don't fully understand every aspect of this illness yet. So thank you very much for all that you and everyone within the health department are doing for the in regards to COVID.
No, glad to help.
Thank you, Dr. Wagner.
Thank you.
Appreciate everything.
Thank you.
Okay. At this time, board members, would you like to have a discussion regarding reopening? Our first proposal was to reopen on the November 5th, but I would like to also share with you, so we have Dr. Wagner's data going through the dashboard. We really appreciate that. And I would like to share with you the survey results that we did with our parents, if you don't mind. Okay, Ms. Moore, can you go to the next section, please? All right. So after the webinar, we surveyed our parents because the focus was to bring back our most vulnerable learners, which is our pre-K through second grade or pre-K through first grade, just depending on where the numbers landed in the survey. During that time, we had 172 people in our community take the survey. The survey concluded, number one, the survey question stated, did you attend the back to school discussion with Dr. Sterling, which the webinar was held on October 8th? Do you have a child that attends SP Morton, grades pre-K through second? Will you recommend the board approves returning to school on Monday through Thursday for students in grades pre-K through second? Will you send your student to school if the board approves the reopening of school? And will you continue online or virtual learning instead of sending your pre-K to second grade back to school? So those were the survey questions, and here are the results. Then the survey closed today. As of today, we had 122 respondents. Question 1, did you attend the back to school discussion? 75.4% said yes. 92 individuals that attended the webinar took the survey, and we're very pleased for that. We did have 158 community members or individuals signed up for the webinar, and we had 138 actually attend the webinar, and 128 individuals stayed until the end of the webinar. So individuals that are answering these questions really did get the information to be able to respond to these questions. Question 2, do you have a child that attends SP Morton? 32 of the respondents said yes, and 90 said no, which was 74%. Question 3, will you recommend the board approves returning to school for pre-K to second grade? 36 of the respondents said yes, which is 30%, and 70%, which was 85, recorded a response of no, and 1 didn't answer. Question 4, will you send your student to school if the board approves reopening? 70% stated no, 30% said yes. Question 5, will you continue online or virtual learning instead of sending your student pre-K to second grade back to school? 77%, which is 86 of the respondents said yes, and 23% said no, which is 25, and 10 individuals skipped the question. Next. Okay. We also surveyed our pre-K through second grade staff members. So you had a community survey and you had a staff survey. The staff launched on October 9th and there were 16 responses. Question 1, are you comfortable returning to your website? 44% said yes and 56% said no. Question 2, are you comfortable traveling to work if required? 44% said yes, and 56% said no. Question 3, would you prefer to work from home if that option was extended to you? 88%, 14 respondents said yes, and 12%, which was 2, said no. Question 4, will you have personal issues that require special accommodations upon returning to work, i.e. School/daycare being closed? 33% said yes, and 67%, which was 10 respondents, said no, and 1 skipped. Okay, I'm gonna go back up there. Okay, before I present to you my recommendations, I want to turn it back over to Madam Chairwoman and to see the dialogue from the board and what their recommendations would be.
Thank you, Dr. Sterling. Board members, I open up the floor for discussion in regards to everything we've discussed so far in regards to the return to school discussion.
Could Dr. Sterling, can you scroll back up a slide or two? I think, no, that's the slide. I'm sorry, back down one. I didn't understand, what's your insight on question 5? So many of them said they're not willing to continue the online learning.
Will you continue online virtual learning and sending your student to school? Is that what you're asking me?
Yes, yeah, that seems like a significant number.
Yeah, yes, it is a significant number. And most of the respondents said they will keep their child at home instead of sending them to school. And as you looked at the trend data in the additional slides, it mirrored what the professionals, the teachers said as well, that they would prefer to continue online learning instead of sending the students back to school, which is the proposed November 5th start date.
So my confusion on question 5, the way it's stated, will you continue online learning instead of sending your students? So does that mean whether or not?
No, we're 100% virtual right now.
Right. So are they saying they're not going to, if they don't have the option to go back to school, they're going to not continue the online learning? Is that what they're saying?
No, they are going to continue online learning.
There's, I'm confused. I know I'm confused. I'm sorry.
Is question number 5 in regards to if given the option, would they keep them home? Or is question number 5, if we do return to in-person instruction, would you keep your kid home?
Thank you. Is if we do return. Thank you for that.
Okay.
Yes. If we do return, will you keep your child home? Will you continue with the online virtual learning? Because we're 100% and we started out, will you continue to keep them home instead of sending them back to school?
Oh, okay. Thank you.
Mm-hmm.
Well, when you look at the school calendar, in November, there's Thanksgiving. So they're in school, basically 3 weeks in November, and then it's Christmas break. So that's about 5 weeks total in the remainder of this year. So it seems to me that it's more beneficial just to continue the rest of the year virtual, and then the next semester look at it again and see what we're going to do.
Exactly.
I do have a question for Dr. Wagner if he is still on the line. I think I still see him up here.
I did. I stayed on just in case. Yeah.
Gotcha. In regards to flu season, because it's like you were saying earlier, we're just getting into flu season. That's getting ready to ramp up. And we know that in a normal, because there has been nothing normal about this year, in a normal year, we would, of course, experience some kids that would come down with the flu, and, that would, of course, impact students being able to attend school in person. We would hope they would stay home to help mitigate the spread. Does this VDH have any insight into how they anticipate that may impact the overall health of the community?
There's a couple schools of thought on that. Partly, you're exactly right. We will enter flu season, and there will be cases of the flu. But there's actually one school of thought that would propose that because of the newer learned behavior of individuals with distancing and hand washing and things that we kind of always should have been doing, but maybe weren't quite so good at. It could actually be, it could actually be a little bit better. Other respiratory diseases, to include flu, norovirus, things like that, may actually be a little bit less. But there will certainly still be cases of the flu. And the difference in the flu, obviously, is it does not appear to be quite as transmittable as COVID, but certainly, it will muddle the picture a little bit, because we will have cases you'll have cases, people getting tested for the flu, getting tested for COVID, and trying to kind of sort that out. In either case, frankly, you're not going to quarantine a person with flu, but you're going to try and remove them from the classroom. If they were to come to school ill in either case, the only difference being, you don't quarantine people for the flu. You just hopefully you get over it. And the transmission period is shorter with the flu. It's not that 14-day type window that we're looking at for COVID. So it will make it confusing. There will be, and I know I've talked with a lot of school nurses. Part of the challenge here is in a kiddo, what does a runny nose mean? What does a low-grade fever mean? Are all those COVID? And the answer is no. What you look for in COVID and frankly flu to a certain extent is those types of things, but they're much different than, say, a kid with allergies or, say, a kid with asthma that may have a little difficulty breathing sometimes, but they get sick with COVID and a little bit with flu, but certainly with COVID, and this is a different kind of sick. And that's really what we're looking for to kind of work our way between, what is the normal crud, if you will, or in things versus what's COVID. And then flu, you throw flu into the mix also. But I will say too, I did find that graph, and I don't want to inundate you with information, but if I could, I'll just share my screen, if that's okay.
Okay, that's fine, Dr. Wagner.
I wanted to just show you this. This is the graph that was asked for earlier. And this is a pretty straight shot to the age groups that I know you're most concerned with. Again, the yellow line being that 10 through 19. These are counts of cases per week. So, as these weeks march out, these are numbers of cases we've had in Western Tidewater. So you can see we've reached a peak kind of early August, and it's since tapered off a bit, but 10 to 19-year-olds has definitely exceeded the younger children in cases of COVID. So I'll release this back so you can but I wanted everybody to see that.
Thank you for sharing that.
Thank you.
Do any other board members have any questions, any discussion in regards to the survey results?
I have a
Or
question.
any of the data supplied? Sure.
I have a question for Dr. Sterling. How are we currently measuring the effectiveness of our virtual learning? And secondly, are we confident in that evaluation?
I'm very confident in the evaluation. Number one, we take attendance every day. So we make certain our kids are coming to school. So we are well over 80% of our students actually attending virtual learning every day. And then when you have the Canvas platform, you have the modules and you have the instruction that's built in. So our students are submitting assignments daily. They're graded. They're taking formative and summative assessments, and they're moving through the already scope and sequence that really didn't have to be adapted because they were online. Our students are taking student growth assessments. The high school is almost at 100% taking their student growth assessments. So we're doing very well with having to go from in-person to online within 6 months. Now, you all know that we are not rated or given a grade of accreditation this year. However, we are taking benchmarks, we have school improvement goals, and we're going through the year as if those benchmarks, as if those SOL scores are going to be posted for everyone to see. And the students, the parents, the teachers, they are moving forward and they're doing extremely well.
If I could
Mr.
just,
Holt, go ahead.
I was just going to add something to that. From firsthand experience at the high school level, these classes that I have seen mirror that of any online learning that I've taken in higher education from universities that are, accredited for online learning. The only difference is that they also have, the high school also has the opportunity to have synchronous learning with their teacher, whereas most of the university learning is done asynchronously. But the quality of the material that I've seen presented over a variety of subject matter, as well as the assessments and projects and stuff like that, has really been quite impressive. There's no doubt in my mind that the students are getting exactly what they need in order to, continue with their learning. This isn't just like a stopgap, busy work kind of thing. I mean, they're all in, and I'm very impressed with it.
I will add.
No,
Go ahead, Mr. Holt. Well, I was going to say, I will piggyback on what Ms. Johnson said and add in that, of course, my personal experience is limited to the high school as well, but the staff have been very accommodating and very willing to work with the students. It's not a flawless system by any means, and I would hope that no one had an expectation that it would be a flawless system. But the teachers have been very diligent about working with the students, because sometimes there are technical glitches to where there's an issue with a submission of an assignment, or a quiz locks out, or things of that nature. And the staff has been very understanding and have worked with the students from what I have seen. One thing that I think I can safely say that I've witnessed within my child's classes, because like I've said before, I'm getting a ninth grade education by proxy, simply because I hear it in the background all day long during the mornings. But one of the things that I am seeing is that this actually is allowing the teachers to teach during that time block that they have, with very limited interruptions. And anyone that has been in a classroom setting and taught, you may have a few children that have to get up and go to the bathroom. You may have a few children that ask a question, or there's a disruption in the classroom amongst the students, and all of that takes away from the instruction time. But I'm seeing that the teachers are actually allowed to sit there and instruct the students, and they are available if the students need them. So I think that instruction time probably may be a little bit more than what they were used to having in a regular school block.
Mr. Holt, I think you.
Ms. Burkhalter last month did a great presentation on Canvas, and she indicated some of the really good evaluation tools in there. So good. I knew it would work, but I wanted to have confirmation of that. Thank you.
Well, Mr. Holt, we appreciate that question, because it gives us a chance to actually showcase our division and how well, but I'm always going to say that. Ms. Burkhalter, are you on the Zoom with us?
Yes, ma'am.
Can you please just articulate to our board, when you go to your meetings with Canvas, how far we are as a division and how they look at us and how we're implementing Canvas? And please don't be shy. Mr. Holt really likes you to give it all to him.
Just as much as you like to.
Yes.
So I attend the weekly Canvas meetings just to stay abreast. They have two types of meeting. One is the leadership meeting, and that allows them to keep a pulse on and feel like they're giving us the support we need. But every time I'm in the meetings and people are asking questions, like this week it was, well, has anybody synced Power School Gradebook with Canvas? And I'm like, check, we've done that. And they're like, well, we're afraid that the parent will be able to see all the students' grades being an observer. Well, school board chair, you didn't know 2 weeks ago they put out a security alert on you. And we actually had to handle that because they're like, oh no, Amy Phillips is an observer. She can see all the students' grades. So it's like, no. So then we ended up sending out the PowerPoint that showed the parents how to sync in as an observer through the child's app. So that they too could do it. But, you know, being the gifted learner that you are, Miss Phillips, as soon as it came out hot off the press, you had jumped in.
Yep.
But I am always just smiling from the inside when I sit in those meetings because I hear the challenges that other divisions have went through or where they are. And I'm like, well, Dad, we were there in August, you know, and you know what, Dr. Sterling, she keeps her foot on the gas pedal.
No, I
Sometimes
don't.
I'm like, you're going to drag them, Dr. Sterling. But, you know, I told the specialist today that I was telling Dr. Sterling 2 evenings ago, I literally cannot be more prouder of the curriculum specialists because they have been the legs to this division since August 1, and our teachers are those tabletops. They have put this division on their back, and we wouldn't be where we are today without them. So we continue to stay ahead. Even the timeline that they have out to chunk canvas and pace it, we're ahead of that.
Oh, yeah.
So yes, we're in a good spot, needless to say.
Thank you.
Yes, I will say
Excellent.
I have enjoyed it because like I said, it's been a learning experience. So you have to go into this with an open mind because like at one point my child had a 306% in one class as her grade. So it was a learning curve and the teacher got everything rectified. But yeah, it was, you know, little things like that along the way. And it's been a learning experience. Like I said, I hope no one went into this thinking this was going to be flawless,
Right.
because it's not like this has ever been done before. It's really, yes, maybe on the collegiate level or the secondary level, but not within public education, primary education. So it's a learning curve for everyone. We're trying to invent something new in the primary education. And, you know, I think our group, our team, our division is doing a phenomenal job.
You're absolutely right, Ms. Phillips. And it's so funny because we have to sign in on the chat and I'll put FCPS, and the facilitator said last week, FCPS, and they said, oh, that's Franklin City Public Schools. So,
Hey, we don't
anyway, that's my time. Thank you all.
This is Jerry McCreary of Ward 6. I do want to compliment y'all on implementing this. My personal experience in work is that for the last 20 years, I've been working online. My clients are always in other states or some are in other countries. And so I don't have that face-to-face. And what I have found working online that way remotely is that I'm actually able to focus more and there's less distraction. You can be a lot more productive. So I think it's a good experience all the way around. I'm not suggesting not to go back to school at some point, but it's definitely a good experience for the future for a lot of these students.
You're right. Thank you for that. You're definitely right. We're ready for the socialization. We're ready to see the kids, hug the kids, be with the kids. But we want to make certain that when we do it, that it is safe. But I was just talking to a teacher today that says, you know I have to stay home. I have, you know, underlying illnesses, but I really miss the kids and I'm looking forward to come back. And that was a teacher who teaches my son. So we got all these grade levels and all my children are SB Morton. But when you say make the kids are more attentive, I have a daughter who is in 3rd grade who gets up, dresses herself, and actually is on Zoom and telling me, be quiet, I'm in my class. So I'm very, very impressed. And the last thing, because I don't want to talk about my kids too long, I was so excited when she brought home the second series of her novels. They already finished one novel, and this is third grade. They're on their next novel, which is The Mysteries of Nancy Drew. So you know, I was like, ask me more, ask me more, ask me more. So we're rolling. They're rolling, doing an
Yes,
excellent job.
and that's a great point though, Dr. Sterling, because and I shared this with you previously, but my child has not been an avid reader for several years. She doesn't like being forced to read. She likes to read for pleasure. So AR has been a challenge for us, or presented a challenge for us when it came to reading, and turned her off from reading. And literally in the first 3 weeks of class, her teacher has gotten her back interested into reading again. And she has come and stolen. I have a collection of, and Miss Johnson and I share this love of Edgar Allan Poe. So she has come, and I have a collection of thick book of all of his works, and she's stolen that from me. My child has stolen that from me to read, all because of what she's gotten from her English teacher this year. So
I love it. I love it.
Well, I know Burkholder's,
Okay.
we know you're on top of it.
Yes.
He is.
Dr. Sterling wouldn't have it any other way.
She can actually be a consultant for the state. She is that good. And I tell you, she's a closer, and it's something to have on your team, someone that could take the vision and close it. And you don't have to come back to her, and it's always done at the highest level. So Ms. Burkhalter, your team, the principals, just everyone involved, we're really making this work. And as we always want to do things in flagship fashion, I can definitely say our online learning, though we've had some hiccups, is being done in flagship fashion.
I have one other question. With all that's being learned through setting this up, I mean, do you see future use even once schools are reopened?
I definitely do. I've said this before. I definitely do. I feel like our kids are more focused. They're thinking critically. Some of my introverts are now extroverts because they're looking in the camera to the teacher. So this is helping with confidence with our children. But I also think that as the upper grade levels, our middle school students begin to progress to 12th grade and beyond, we talk about making certain that they're prepared for college and careers, and a lot of them are online learning. So I definitely see us not having a full 5-day week, but possibly a hybrid model of 3 days in, 2 days out, especially in the early college and the early high school models that we have at J.P. King and FHS.
Right.
So yeah, I do see it.
Gives you a lot potential possibilities.
Oh, yes. Oh,
and
yes.
Mr. McCurry, one of the things I thought about, and as you're coming in and you're learning the school board stuff, because you know it's trial by fire here.
Yes.
But one of the things that first stuck out when we started talking about virtual learning, if a child is out of school sick pre-COVID, then they're just out of school sick and they're counted absent. Well, if they're out of school, for instance, maybe a doctor takes them out for a medical reason, maybe it's not something contagious, but this presents an opportunity that the child could be at home and could still be engaged in the class by logging on online. So this, I feel, is going to forever change education as we know it.
Right. I agree.
And you have the luxury of voting on that. So I can't do anything unless you give me the green light. So that's definitely conversations we have to continue to have.
Well, the excitement is building for the next slide. So
Are you ready to continue, Dr. Sterling?
Yes.
I'm ready to continue. The discussion is complete. I've had the opportunity again to look at the data have discussions and with Dr. Wagner with this webinar and here this evening. And I've also been here going on my 4th year, and I've been through 3 flu seasons, and it always hits the elementary the hardest. So with that said, and taking in other factors, as we look at the trend data, hopefully begin to trend downwards within the next couple of weeks, my recommendation to the board would be based on the survey results of FCPS stakeholders, the academic calendar that one of the board members just mentioned, and the COVID-19 climate in Franklin City and surrounding areas. I recommend that schools continue to operate virtually through the end of the first semester, which would be Thursday, January 28th, 2021. Other factors that I considered was cold and flu season, building ventilation, high-risk employees and students. And we always look at our employees and students because we want to make certain that they're safe because they have to go home to their family and their loved ones. Reevaluation of this recommendation to open up schools. I would like to come back to the board and look at trend data and see where we are at our first work session in January, in 2021. And that is my recommendation.
All right. Dr. Sterling has presented her recommendation to the board. I will actually open the floor up for discussion on this prior to us making a motion on it. Does anyone have any discussion they would like to lead off with?
I personally like the recommendation and feel there's a lot of background work done to support that. And I would certainly vote for it if it comes to that.
Thank you.
Anyone else?
Well, I've already stated the support for it based on the academic calendar.
I agree. I tend to vote for it.
I agree. And one item that's in there that we haven't even really discussed as a board is that middle item in the other factors considered, the building ventilation. I mean, I know we have adequate heating and air within the facilities to keep the students comfortable when they're in the classroom, but given the age of our buildings, and yes, you can slap a higher grade filter into an HVAC unit, but is it able to circulate the air adequately to actually do what's needed to do to cut down on those particles floating through the air? So, that's another consideration as well. So I'm of the same position that everyone else is. And I've seen just about everyone nodding and comments from everyone, except for Miss Johnson. Not to put you on the spot or anything.
Oh, no, I'm completely for this. I think it's very well thought out. And I have a student at home who is craving the social aspect of it. But even knowing that, I understand the importance of, the entire school division as a whole. And so does he. And he's adapted very well virtually. And there are still some struggles that I'm not going to, lie. Some students would benefit from, having that one-on-one with the teacher, but the teachers have been absolutely excellent with reaching out to the students and making themselves available. And he has taken it upon himself, I know, to communicate with his teachers when he's had questions outside of the curriculum. So I fully back this decision.
And one thing that I want to touch on that you said, Ms. Johnson, the teachers have been very willing to work with the students outside of their block for that class as necessary. And I just want to push out to parents, if you're finding anything different, you've got to communicate that to with the teacher. And if that's not getting you anywhere, then to the building administration. we do still have telephones, and telephones work regardless of what my children may think that thing in their hand is an internet device. They do still work as phones. But communication is key to making this whole process work. So if you're finding that your child is having difficulty, reach out to the teachers. That these teachers are here to teach students. They are here for them to learn, regardless of what anyone may think, and they are more than willing to do that. Sometimes even if it's not your student's teacher, they're willing to help your student, as we have been witness to personally. So I do want to push that out, that, make sure that, reach out if you do need help or if your child needs help.
And I do want to make this one statement as well. Please contact your principals because we are still in online learning. We did receive our hotspots for students that are having issues with connectivity. Please contact your principal if you need support in that area. And I also wanted to make one more statement that if the board decides to vote to review returning to school by Thursday, January 28th, this will not affect sports. VHSL has agreed to put a press release out and notify all superintendents that sports will continue in December 2020. So this will not affect sports. So hopefully your child is involved and can get into some of these activities so there can be some socialization as well.
Dr. Sterling, I have a question on that point. Being that some of these extracurricular activities will be resuming in December, if our students are not back in the classroom learning, if we are still in a virtual learning environment, will we be making accommodations for those extracurricular activities to be able to get together and practice? Because I know that will be fundamental in some of these extracurricular activities.
Thank you for asking that. Yes, we had to have a reopening plan for academics, and we also had to submit to the state, an athletic plan for COVID-19 as well. And that will be uploaded to our website, but all of the mitigation strategies are in that as well, regarding cleanliness, washing of hands, masks, the 6 feet, going outdoors as much as possible. All of that is in our plan, and Dr. Lane's office did approve our plan.
Any other questions from board members?
May I make a motion, Madam Chair?
Absolutely, Mr. Holt.
I would like to move that the board support the reopening plan that Dr. Sterling has presented, meaning virtual learning through the end of this semester, ending Thursday, January 28th, 2021.
We have a motion on the floor. Do we have a second?
I second that.
We have lots of seconds. Any more discussion? Hearing none, all those in favor of moving by ward signify by saying aye. And of course, nays and abstentions have the same opportunity.
Ward 1, aye.
I, Tanya Smith, Ward 4, aye.
Good evening, Ms. Smith.
Good evening.
Good to see you.
Marshall Williams, Ward 4, aye.
Andrea Shelton, Ward 5, aye.
Gary McCreary, Ward 6, aye.
Carrie Johnson, at large, aye.
And Amy Phillips, Ward 2, aye. That motion carries with all 7 votes in favor. So that looks like we will be virtual through the end of the first semester. And of course, we will reconvene as we approach that date to have a discussion on what we look like at that time, and if we need to move into hybrid model or what we need to do in regards to reopening.
Absolutely. Thank you, board members. I really appreciate this. Thank you.
Thank you so much to you and your team on your work on that.
Thank you.
All right. Do you have anything else for us, Dr. Sterling?
That concludes the superintendent's report. Thank you.
Awesome.
I'm done.
Sterling report.
Next up is item number 5, which is business by school board members. I've got a few items in there, but I want to open it up to the other board members first. Does anyone have anything to share with the board?
Well, one agenda item that we have continued to put back relates to the governor's handbook. And I would like to work with a few board members and try to divide that up a little bit and see if we can get certain board members to look at certain parts of it so we can come together and kind of wrap that up. So with permission, I would like to begin doing that.
All right. Do you have an idea of how you would like to the board to proceed with that, Mr. Holt?
Well, yes, I have a list of all the sections, and I would like to contact each board member to see, number one, if they have a particular section they're interested in, and just make sure we cover all the bases.
Okay. Does anyone have any disagreement with what Mr. Holt is saying or any discussion they'd like to have about that?
I agree that it's time to move forward with the governance handbook.
Is everyone okay with Mr. Holt taking the lead and contacting you?
Yeah.
That's fine.
Yes.
That's fine.
Yep.
Then Mr. Holt, I so delegate that to you, and I appreciate you offering to do that.
Thank you. My deadline is 2023. So I hope we can do it by the end of the semester.
I hope so too. I think we've done some preliminary work on that, and really when I looked at it, it's not, we've already made a big chunk by going through and looking at the boards and committees that we sit on. So that was one of the highlights that we had to go back and look at. So that's good that we've gotten that one out of the way. And overall, it's not a very lengthy handbook. So hopefully we can knock that out pretty quickly. Anything else? All right, well, hearing none, I've been a very busy person for the last couple of weeks. And I did sit in on the VSBA webinar for parliamentary procedure, which Ms. Moore has attached for your review. The information from the webinar, it's the slides. It was very, very similar to what I had set through before in board chair orientation. It goes through and talks about motions and amending motions and voting. One of the takeaways that I did have from this, and it's come up from time to time, is voting. So what I did learn is that in the event that we do have a quorum to have a meeting and there is a vote carried, it does not have to pass with the majority of the board members that are seated. For instance, if we had 4 show, that's our quorum, it would not have to require 4 votes to pass. It would have to have the majority of the votes of the board members that actually vote. So if we have 4 and 1 abstains, that's 3 voting members. So we would only have to have 2 votes for the motion, for the item to carry. That is one thing that I did pick up on and learn, which I thought was very bizarre, but it actually was a lengthy discussion on that. So that is there if anyone would like to review that. Also, the HRETA, the WHRO meeting, that was kind of a quick turnaround from our last meeting on when we found out that next meeting was, and Dr. Shelton was not able to attend. So since I knew I had time, and rather than dumping it on Mr. McCreary all of a sudden, I went ahead and sat in on that meeting. And Mr. McCreary, I may get with you on that for the next one in December. But this was actually a very good meeting. I thoroughly enjoyed it. I think Dr. Sterling enjoyed it as well. They presented one of the recent addition to the offerings for HRETA is a course on African American history. And they previewed that for us. So that was really the highlight and the bulk of that meeting. They did go over, of course, their business that they normally would, and just touch back on their annual report, since they haven't been able to come out to all the divisions yet to present that. But that was the bulk of that meeting. Their next meeting is on December the 2nd. And of course, we don't quite know I don't know what that meeting will be on. That was not discussed, but their next meeting is on December the 2nd. And moving on from that, yes, the part of that discussion was the annual Virginia National History Day. That information, Ms. Moore was kind enough to put that out in a separate document so that all teachers will have access to that, in case the teachers do want to register their classes for that event. So that's out there. Also, the Appomattox Regional Governor's School monthly board meeting was last week. Not a lot from that. The biggest was they discussed their return to school plan as well, and it was voted on to continue as we were right now with virtual, because by the time we got to that vote, we did not have a quorum anymore because the board members had left. So we did not have a quorum. So for the time being, ARGS is still in a fully virtual model. One thing that did stand out to me right now, that tuition per student is roughly $8,000 for our students to attend ARGS. One of the things that they did discuss, because they of course are trying to up their numbers, and they actually just added a new focus, not a new focus group, a new major under one of the focus groups, which is music technology. But one of the things that ARGS did discuss was the per pupil expenditure, which does come up from time to time, looking at what each division, when they take all of their expenses and average it out per student, how much they spend per student. ARGS did indicate that of the 14 school divisions that send students, and you've got Richmond, Chesterfield, Southampton, Sussex, us, Amelia County, Colonial Heights, the per pupil expenditure runs between right at almost $13,000 up to just over $18,000 per student. We actually fall on the low end of that. Our per pupil expenditure is just under $15,000. So we're on the lower end of that average per student. The delegate assembly training has begun. Of course, I emailed all board members earlier today that lovely thick delegate assembly handbook. The items that are being voted on at the delegate assembly start on page 86 of the handbook. There's two sections. There's one on the actual legislative positions. And all those items are for us to indicate to VSBA whether we approve of VSBA's lobbying position on those items or whether we oppose those. And then the next section behind that is the VSBA bylaws. They're looking at some changes to the bylaws. Those would, of course, if approved, be implemented and change those bylaws. That is all that I have, which, yeah, that's enough. Does anyone have anything else? All right, important dates to remember. We've got one change to that, which is the second item, the first day of hybrid and in-person instruction. That is being, of course, moved as we just voted to January. But the end of the first 9 weeks is November the 4th. Interim report cards went home this week, so students and their families should be receiving those in the mail. One thing I will say in regards to interim reports for the families within our division, you can keep up with your students' grades by logging into PowerSchool, and there is information on the website in regards to that. And if you need some assistance, please contact your child's school, and they will get you connected to someone to help you get that set up if you're not. It's a wonderful resource. Also, our next school board meeting will be on Thursday, November the 5th. Of course, the division is closed for Veterans Day on the 11th. And report cards do go out on November the 12th. One additional item that is not up there, the VSBA regional meeting. So that is the meeting for our school boards within our Tidewater region, will be on October the 28th. Each of us should have received an email in regards to that. If you did not, let me know. And I'll get in touch with the regional chair to make sure that you do receive that. And that's virtual, of course. Anything else in regards to important dates coming up? Anything else under business by school board members?
Adjourn.
Anyone ready for number 6?
Adjourn.
A second.
Second.
I hear a motion in a second. If there is no objection, then we will be adjourned for the evening.
9 o'clock. All right.
All right.
Hearing no objection, I now call this meeting adjourned. Thank you, everyone, for your patience with us tonight. And thank you, everyone, for joining us. I look forward to seeing you November the 5th, if not before.
All right.